My dear colleagues and dear juniors, Assalamu alaikum wa rahmatullahi wa barakatuh. I am Dr. Fauzia, a PG scholar from Department of Moalajat. Today's my synopsis presentation is a sequence of PG orientation program as per guideline of NCISM. My today's synopsis presentation will be in the format of synopsis, which is prescribed by AQU, that is Aryabhat Knowledge University. First is the need of the study. Hyperlipidemia is a term that encompasses various genetic and acquired disorders. It describes elevated levels of lipid within the body. It is very common disorder. Hyperlipidemia is actually a pathological condition which includes increased LDL, cholesterol, elevated triglyceride, both, and it may also increase high density lipoprotein. It is very common disorder in its Western Hemisphere, but worldwide its incidence is very high. It has also very underlying pathology. It is more common in India also, and in India it is about 30 to 40% in urban and 10 to 20% in rural. It is more common in urban because of their lifestyle and stress and the food they intake. The urban population take a lot of amount of trans fat, which thereby impairs the lipid metabolism and increases or decreases or disbalances the lipid profile of the patient. It occurs in both gender, but it is more common in males, and high prevalence is among 60 years or above age. The pathophysiology of hyperlipidemia has been linked to the pathophysiology of cardiovascular disease, diabetes mellitus. It is most common risk factor for cardiovascular disease and diabetes mellitus. India is in the middle of an epidemic of atherosclerotic cardiovascular disease, which is showing no sign of abating. The incidence of coronary artery disease is increasing most rapidly among patients younger than 14 years of age. It is found that about 10 to 25% of myocardial infarction in India occurs before the age of 40 years. About 50% of cardio CAD associated with death in India occurs before the age of 40 years, 50 years, sorry. There is no cure of this metabolic disorder in the prevailing system of medicine, that is allopathic system of medicine. They are using a lot of lipid-lowering substance like niacin, fenofibrate, atorvastatin, resins, etc. But these drugs lowers the lipid profile, but causes a lot of hepatotoxicity, renal toxicity, bloating, dyspepsia, myopathy, dyspepsia, and alopecia, etc. So there is great need to find an alternative in the traditional system of medicine. And our renowned Unani physician has advocated the use of many drugs which are hot in temperament, and it modulates the liver function, and thereby it lowers the lipid profile. Some of these drugs are Lukemaksul, uh, Lasun, Zanzabir, Sandroos, etc. For lipid lowering or for the cut of fat, Lukemaksul is commonly used as a Safoof mahazil. But Safoof mahazil should not be used in the reproductive age of the patient, female patient, because a study was carried out in Bangalore in the female lice, and it was found that it causes infertility in the female. So be cautious using Safoof mahazil. Hence, I have designed this study to evaluate the efficacy of Safoof Sandroos along with Sucandibin Sada in the lowering of the lipid profile of the patient. Now coming to the topic review literature. There is no such description of hyperlipidemia in our Unani classical text, but but there is some certain condition which we can correlate with it. In classical Unani literature, the description of hyperlipidemia is not, but Unani scholars advocated and described seminal mufrat, which is almost similar to hyperlipidemia in all aspects, as in etiology, clinical feature complications, and finally management. Ali ibn Abbas Majusi, in his books Kamil Sana, told that obesity is very dangerous for a person, especially when it is in primary. Sheikhul Buharisina, in his famous book Al Qanun al described the etiology, clinical feature, complications, and management of obesity in details. According to him, excess deposition of fat in vessels lead to hypoxia due to narrowing of blood vessels. He further stated that these blood vessels could rupture, resulting in massive hemorrhage and death. Obese person is much prone to suffer from various complications like paralysis, stroke, palpitation, and breathlessness. Also, Ibn Nafis, in his book Moalajat Nafisi, describes the association of cardiovascular and cerebrovascular disease with obesity. Ali ibn Abbas Majusi, in his book Kamil Sina, said that obesity is very dangerous for a person, especially when it is in primary, that is ibtada. Further, he told that hararat ghazi of such person is low and blood vessels of his body are narrow and compressed. The abnormalities of Hazmi Kabdi is found to the there are three condition that alter the function of Hazmi Kabdi. First is the Barudat Jigar, that is cold temperament of the liver, which causes the interference in the digestion of food. Second is the obstruction by viscous matter and the inflammation which may cause partial digestion of nutrition. Third one is the nutrition resulting from alteration in quantity or quality, that is kamiyati or kafiyati of ghaza. These are the references which are taken from the Unani classical text. We just have to validate it. And according to Unani classical text, the drug of Har Mijas modulates liver function. Sandroos has been found to be high in Mijas, and thus it is used by our Unani scholars for many decades for cut the fat. Now come to the point, aim and objective. The aim and objective of my study is to evaluate the clinical efficacy of Safoof Sandroos in the management of hyperlipidemia. And I have taken the reference of Sandroos from the 5 books, that is Al-Mukhtarat al-Fittib, Zakhira Khwazam Shahi, Sheikhul Buharisina ki book Al-Qanun al-Fittib, Bustan al-Mufradat, and Khazan al-Adwiya, etc. In that book, it is mentioned that the standard dose is mentioned 5 rati 5 masha, which almost correspond to 2.5 to 2.6 milligram. And the Sandroos is a resin which is obtained from the tree Shoya robusta, and the best type of the Sandroos is found Tanzania of South Africa. It contains active ingredient tetraopium acid. Next, my objective is to provide safe and efficient drug, and also to provide cost-effective drug. Now come to the material and method. Sources of data will be the patient obtaining or treatment from OPD of the DCCH Patna, and the patient who fulfill the exclusion and inclusion criteria. Method of selection of the patient will be from clinical examination and laboratory finding. Now come to the subjective parameter. Subjective parameters varies from person to person. The first one is the palpitation. Palpitation is actually the abnormal rhythm type of the heart. The heart feels that an extra pulse has been beat is added, or he has skipped up a beat. Second complaint is breathlessness or dyspnea. Breathlessness is discomfort in breathing or pain in breathing, and dyspnea is the shortness of the breathing. Next is chest heaviness. The patient complains of the chest heaviness as a pain or discomfort in the chest, and he may feel like a stabbing pain or quenching or sharp pain or crushing type. Tachycardia is actually abnormal rhythm of the heart. In resting heart, the heartbeat is 60 to 100. If it is